Hello everyone, welcome back to our Facebook Live series where we tackle different topics related to breast health, breast cancer, and Komen. I'm Katharina Kang, the Mission Programs Director for Komen North and West Texas. As a reminder, you can catch all of our past videos either here on our Facebook page in the video section or on our YouTube channel. Just search for Komen North and West Texas. We're continuing our discussion of breast cancer and health disparities among different ethnic populations. Last month, we examined breast cancer in the Asian and Pacific Islander American population, and today we'll focus on how the disease affects Hispanic Latina women. According to the U.S. Department of Health and Human Services, Office of Minority Health, this ethnic group includes any person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture or origin, regardless of race. According to the 2017 U.S. Census Bureau population estimate, there are 58.8 million Hispanics living in the United States. This group represents 18.1% of the total U.S. population. In 2017, among Hispanic subgroups, Mexicans ranked as the largest at 62.3%. Following Mexicans are Puerto Ricans, Central Americans, South Americans, and Cubans. In 2017, states with the largest Hispanic populations were California, Texas, Florida, New York, Illinois, Arizona, New Jersey, Colorado, New Mexico, and Georgia. About 1 in 10 Hispanic Latina women in the U.S. will be diagnosed with breast cancer in her lifetime. That rate of incidence is lower than that of white women and black women. As a result, Hispanic women also have lower mortality rates than other populations in the U.S. However, despite their lower incidence rates, breast cancer is still the most common cancer and the leading cause of cancer death among Hispanic Latina women. An estimated 24,000 new cases of breast cancer were expected to occur among Hispanic women in the U.S. in 2018. And an estimated 3,200 Hispanic Latina women lost their lives to breast cancer in the U.S. in 2018. If you recall last month's Facebook Live, we talked about disparities in the Asian Pacific Islander populations. Disparities refer to how different communities are impacted by breast cancer incidence, mortality, and survival. Many disparities are caused by barriers to care like language and cultural differences, lack of access to preventative care, lack of health insurance, and lack of information about breast health. Some findings show Hispanic women may have a higher number of barriers to getting screening mammography than women of other ethnicities. It is significant to note that Hispanics have the highest uninsured rates of any racial or ethnic group in the U.S. The 2017 census reported that 49% had private insurance, compared to 75.4% for non-Hispanic whites. So, because Hispanics have a high rate of being uninsured, and because not having insurance is a major reason that women and men do not get screened for breast cancer, it is not a surprise that Hispanic Latina women are not getting their mammograms regularly. When it comes to breast cancer screenings, Hispanic women overall get screened at a lower rate than black and white women. However, trends show that Hispanic screening rates are increasing. Screening mammography use among Hispanic Latina women also varies by subgroup. For example, Puerto Rican women are more likely to get a screening mammogram than non-Hispanic white women. Puerto Rican women are also more likely to get a screening mammography than Cuban American and Mexican American women. In addition, compared to Hispanic women who have lived in the U.S. for a short period of time, those who have lived in the U.S. for a long period of time are more likely to be screened. Hispanic Latina women tend to be diagnosed with more advanced breast cancers than white women. This may be due to lower mammography rates and more delays in follow-up after an abnormal mammogram. Increasing access, awareness, and sensitivity may help remove some barriers, especially for poor and uninsured women, that prevent women from getting screenings and follow-up care. This includes improving access to mammography and primary care, removing financial barriers, removing language barriers, community education such as health campaigns that address negative beliefs and feelings about mammography, and ensuring healthcare providers are sensitive to the needs of women from different communities and cultures. When a provider doesn't recommend a mammogram, some women feel they don't need one. A goal of the Affordable Care Act was to reduce barriers to health care. It requires insurance plans to cover mammography costs with no copayment. Since the time the Affordable Care Act became law, the gaps in screening mammography disparities between women with high and low income levels and between women with high and low education levels have lessened. If you are 40 years or older and have an average risk of breast cancer and your provider does not bring up routine mammography, ask him or her to talk with you about breast cancer screening and when and how often you should get a mammogram. If your mammogram shows something abnormal, you will need follow-up tests to check whether or not the finding is breast cancer. A patient navigator at your medical center may help you coordinate your follow-up tests. It's important to get follow-up without delay. If breast cancer is found, it's best to be diagnosed and treated at the earliest possible stage, increasing the chance of survival and possibly decreasing the cost of treatment. If you or someone you know needs a mammogram, please visit our website at KomenNWTX.org or contact our office and we can put you in touch with any one of our community grantees. These are the organizations that have received funding from Komen North and West Texas to provide free breast services like mammograms and diagnostic services to residents of our 91 county service area. Our grantees are bilingual, Spanish speaking, and can assist setting up appointments with a breast health provider. You can also call the Breast Care Helpline at 1-877-GO-KOMEN, where bilingual cancer care social workers can navigate patients through the services they need. This month, we're spotlighting Komen scholar Ann Partridge. Dr. Partridge is a professor of medicine at Harvard Medical School and vice chair of medical oncology at the Dana-Farber Cancer Institute, where she serves as director of the Adult Survivorship Program and leads the program for young women with breast cancer. She is also co-chair of the Alliance for Clinical Trials in Oncology Breast Committee. As a medical oncologist and clinical researcher, Dr. Partridge's research focus is to improve the care and outcomes of patients by understanding the psychosocial, behavioral, and communications issues in breast cancer care and treatment. She established and served as PI for the Young Women's Breast Cancer Study, a multi-institutional cohort of young women with breast cancer, which enrolled 1,300 women aged 40 and younger at diagnosis. Dr. Partridge and her team have characterized a range of issues of young breast cancer survivors, including the impact of treatment on fertility, adherence with hormonal therapy, psychological adaptation to the diagnosis, including impact of treatment on sexual functioning, and the factors that play an important role in patient decision making. She has collaborated with basic investigators to identify molecular differences in tumors found in young patients and identify potential biomarkers of long-term effects. Dr. Partridge's Komen-funded research aims to understand and improve the unique medical and psychosocial issues facing young women with breast cancer. You can learn more about Dr. Partridge and all of our Komen scholars at komen.org/meetOurScholars. That's it for this month. We've got a lot of great events coming up in the next several weeks, including our Amarillo More Than Pink Walk on September 28th, Wichita Falls Race for the Cure on October 5th, and Lubbock More Than Pink Walk on October 12th. Details are on our website. Go to KomenNWTX.org to register today. Thanks, and we'll see you next month.